Welcome, everybody. I think there might still be a few people getting pulled into the webinar. They will be with us very shortly, but I'm really pleased to be chairing the webinar today, which is part of British Science Week and part of British Healthcare Science Week. I'm Della Freeth. I'm the Chief Executive of the Science Council, and I'm very, very pleased to be joined today by Sam El-Badri, who works with Sense About Science and is going to talk to us today about responsible handover of artificial intelligence. First of all, I'll just tell you a little bit about the Science Council. So we're a registered charity. We have a royal charter that was granted in 2003. Our vision is a diverse and growing science profession that is trusted, respected, innovative, and equipped to meet the regional, national, and global challenges of our time. Our purpose is to connect the science professions and to offer professional recognition for scientists, science technicians, and science teachers. We're a community that is collaborative and interdisciplinary and contains more than 30 professional bodies and learned societies. They're across the entire breadth of science. They differ in their focus and their size, but they're all passionate about science. They're all passionate about good science. And you'll see the logos of those organisations there. So we work together to inspire, to develop and support scientific professionals, the workforce of today, and to think about the workforce of tomorrow. We're committed to professional recognition of the diverse range of people who work in the myriad of roles across the breadth of scientific disciplines and applications. We believe that by raising standards of practice and encouraging innovation, professional registration benefits the individual, their employer, and society. The Science Council sets the standards for 4 interdisciplinary professional registers which recognise workplace competences and encourage career-long professional development, ethical practice, and sustainable professional practice. So registrants demonstrate commitment and competence and agree to follow a code of professional conduct. We take a particular interest in vocational routes into the science workforce, such as T-levels and apprenticeships, and we're grateful for grants from the Gatsby Charitable Foundation, which helps support this work. For example, we've mapped over 30 apprenticeships to our professional registers, and we're able to offer shortened application routes for professional registration after successfully completing a mapped apprenticeship. We work with employers and policymakers and organisations that shape and deliver the education and training landscape for the science workforce. We pursue high quality workplace learning to support scientific excellence, innovation, and the recruitment and retention of the workforce that our nations need. So this image shows logos of Science Council employer champions. They're a particular group of organisations that we collaborate with, and we also collaborate with many others where we have shared interests. So this week we've had a series of webinars. Today is the 4th, and as I've already said, I'm delighted to welcome Sam El-Badri here today to talk about responsible handover of artificial intelligence. Sam, I'm going to stop sharing my slides and hand over to you.
Thank you very much.
Oh, I'm so sorry, Sam. I've forgotten to say something that the participants will need. When you want to, if you think of questions that you want to ask Sam at the end of his presentation, could you please put them in the question and answer part of the screen that you have there, rather than putting them in the chat? We'll manage them from there. Apologies, Sam. Do go ahead.
Okay. I'm just going to do the awkward shuffle over to my presentation. Let me know if you're happy for me to proceed.
Yes.
Right. Right. Hi, everyone. My name is Samuel Bedri, and I'm with Sense About Science as project officer. I'm going to talk to you today about what you're doing to support the safe and effective use of artificial intelligence and other data science tools using a framework that we have created called the Responsible Handover Framework, which we launched publicly in September alongside Welcome. This framework was developed in the... Oh, sorry. This framework was developed in the context of emerging technologies such as AI are no longer being used only by tech experts, but by people who may not necessarily have the required technical expertise to understand how a tool has been developed, how to use it properly, and how to ensure that the software that gets produced by developers actually gets used rather than going to waste. So, just a bit of background into what we do at Sense About Science. We launched amongst a backdrop of intense public debates in 2002 surrounding science and health stories, such as how safe GMO crops are, vaccines, and alternative health treatments. And these topics often led to public scares based off unverified or false information. So, our key mission is promoting the public interest in sound science and evidence, and we do this through multiple avenues. We equip the public with questions to ask of science and assessing whether information they come across is to be trusted or not, such as creating easy to read guides on hot topics. We run campaigns on how transparent government has been when they introduce a policy. And we also equip scientists to communicate their research more effectively via workshops and guides, such as explaining the complex peer review process. We ran a campaign called All Trials several years ago, which addressed growing concern amongst the public that less than half of clinical trials that were performed were not being published. This was an issue that had been known for some time and had been discussed extensively, but nothing was changing. Drug companies were still refusing to publish all the research they had done on their drugs, which academics had also been guilty of. And the research that was not being published was often that which would have been most valuable, such as trials where the drug did not work or cause serious harm. As not all clinical trials were being published, there were several cases where people were taking part in trials which had already been done elsewhere in the world, wasting time and money of all involved. And the same side effects that had befallen patients in previous trials were happening over and over again. We couldn't believe that nobody was fixing this. So, over the course of 10 years, we, alongside thousands of people and organizations, of which a handful of them are illustrated here, joined the public All Trials campaign, calling for all clinical trials to be published. Now, were not being published not just for secrecy and withholding bad data, but also that people didn't feel the need to because they were under no public pressure and there was no hit to their reputation for when they didn't publish this data. All of these organizations listed played crucial roles within their own research ecosystem, whether that be patient groups, consumers, or health services. They were all able to apply pressure within their own networks. And now, flash forward to the present day, it's now legally required for all clinical trials in the UK to be registered in a World Health Organization public register and for results to be published within 12 months of clinical trial. And we're now close to 100% compliance. What the All Trials campaign showed us is that people really do care about evidence and ensuring that they are fully able to explore the reasoning behind the decisions affecting their lives. And this public interest in evidence and transparency in decision making was extremely prominent during COVID when models were being used to track how quickly the virus would spread. But people, including the policymakers using these models, didn't understand how they worked. So we created a guide that equips people with the right questions when presented with simulation models to make decisions. These models have also been used to develop policies that can help mitigate climate change, for example. Despite the increased use of these models, the people using them were concerned that they were not well equipped to scrutinize how robust they were and in what situations they should be used. So this guides people through a list of questions to help assess whether a particular model is the right tool to use and how to interpret the results correctly. And these questions covered things such as what the unknowns of the model are, how accurate it is, and if there are any other alternatives. And we developed this guide alongside the Joint Research Centre at the European Commission to help members of the European Parliament, citizens, and scientists. And this guidance was officially incorporated into their public platform so that anyone can access it. So, over recent years, there's been a huge surge of public interest in AI because of its introduction into daily life. So now we see headlines such as the ones here nearly every day. Because of the speed of its deployment, we realized around 2018 that there was a serious lack of understanding into what AI and algorithms actually are, the so-called black box issue. A lot of us know what AI can do, but we don't know how it does it. As people are unsure how these tools have been developed and what the extent of their use is going to look like in the future, we've ended up in a situation where people are afraid of AI, quote unquote, taking over, and real concerns that AI will be implemented in an unethical manner or cause serious harm, either intended or unintended. And part of the problem with this is the inaccessible language whenever words such as algorithm and big data are thrown around. So we created a guide for members of the public to have the right questions to ask of data science. And this guide is not meant to be a dictionary of terms, but to give non-data scientists access and empowering them to understand what data is. It introduces three questions that people can understand of the science, such as where does it come from, what assumptions being made, and can it bear the weight being put on it. Understanding how AI works isn't so important when using AI for less intense purposes. Someone using ChatGPT for a cooking recipe doesn't really need to know how text has been produced in front of them, nor does someone using a filter on TikTok to make a viral video. But in situations where a bad decision can cause serious harm, these questions need to be asked and answered. The information into how these tools are developed and how to use them properly often remains stuck in the brains of those who developed them, and this knowledge needs to flow downstream to the people using the tools so that people feel assured that they are doing the right thing. As AI and other technology gets developed and utilized, they go through multiple transfer or handover points. For example, this diagram shows the journey an AI tool to detect skin cancer just by looking at a picture may take. It starts with a statistician creating the algorithm for grading skin cancer likelihood by analyzing an image. This tool is passed on to a researcher who tests the effectiveness of this tool over a large population and tailors the algorithm based off the feedback they receive. This tool is then passed on to an app developer who works on commercializing it by making the interface user friendly. And lastly, the tool ends up in the hands of a doctor who uses the tool in their clinic. At each handover stage, vital information about the strengths and weaknesses of a tool are vulnerable to being lost, as shown in the diagram with the red text. For example, the data used to train the model may be entirely forgotten as the tool is handed over to the app developers and the clinician. For detecting something such as skin cancer, this could be disastrous as the tool performs differently depending on the color of someone's skin. So if the data is lacking input from patients with darker skin, then the tool is essentially pointless to use in darker populations. But if the clinician doesn't know this because they haven't been given this information, then this opens them up to making a mistake that could have been resolved with a proper handover. These sorts of mistakes often happen when the number of users of a tool rapidly grows, or there is a large difference in technical expertise between the tool adopter and the tool proposer. A poor handover process opens people up to several issues. You get the risk of causing unintended harm because you don't know how to use the tool. And this fear can drive people towards using the safer but much more time consuming alternative. You also risk picking up a tool that was not what you expected or agreed upon, causing severe delays and wasting funds. Or research gets misused because clear expectations into how the tool should be used were not set out from the beginning. So handovers provide a real intervention point where governance can be applied to reduce the information lost at each handover stage. And we were approached by numerous people asking us to step into this conversation. And this is what we've tried to address with a flexible framework that can be applied to any sector. When we started to design this framework, we borrowed from other areas of engineering where there are well-established ways to get past the complexity of following regulations and the actual conversations that take place on a regular basis. And that way is to have frameworks in place that can be mandated as they are high enough level to be applicable to everybody. For example, once a bridge has been fully constructed, The contractor does a formal transfer of the completed project to the client. This includes all the documentation and warranties. Any governance framework or guide needs to be as flexible, modifiable, and detailed as possible without becoming too sector specific so that it gets maximal exposure and uptake across different areas. And that's what we've done with responsible handover. It also needs to be compatible with existing standards so that people don't have to choose between one or the other, or people may look at the new framework and decide that it already fits with what they do, which is another way of showing compliance with the framework. So while we've developed a framework that many in the audience may recognize as being applicable in biomedical research, it can be applied to other sectors as well. A framework that everyone can adapt and becomes universal means that it becomes possible to anticipate the potential issues that they should be addressing right from the first development stage all the way through to implementation. And we identified biomedical research as being an area of concern where handovers are happening due to the potential clinical impact of the tools being developed. And working with Wellcome, who are one of the biggest research funders globally, on creating the responsible handover framework. The initial approach to creating the framework took 3 steps. We identified best practice in a sector where handovers are common, and I've already mentioned engineering. We consulted existing frameworks and guides such as OECD, Turing Way, and extracted the questions from those frameworks. And we did this because these frameworks are well established and familiar to people involved in tool development. So we did not want language we used in the framework to be too alien. And then we adopted questions from our data science guide, equipping people with the right questions to ask of data science, as those questions were developed and refined by data science experts and tested with members of the public. We then created a prototype framework with a list of questions tested in these various cases, initially in the biomedical research landscape, and then we refined the design based off the feedback we received. We ensure that when we were looking at where tools are being handed over, it wasn't just a researcher to researcher handover, but looked at the wider context where there are multiple types of handover conversations happening. And through speaking with people involved in tool development and tool use, the overwhelming message we've received has been one of frustration. Many people are concerned that they want to do the right thing, but they don't know what the right thing is in terms of how to release a model, software, or application over to someone else, either through sharing the final product commercially or handing it over to someone else for further development. Before I go into the final framework we created, I just wanted to give a quick thank you to our collaborators who helped us with designing and refining the framework and testing it in some different contexts, some of whom I will expand on later. So this is the framework on the left. I've zoomed out so you can see all the questions, but I will zoom in on each tier shortly. The questions are structured into different tiers, with the questions in each tier becoming more detailed as you proceed further down. For example, the first tier of questions asks very basic prompts about what the purpose of the tool is and if it's to be introduced in a different context. As you can see, the framework is designed in a way that a scripted conversation takes place between the tool adopter and the tool proposer, so that the onus is not on one party to send or receive the required information. It's a 2-part process. After the first tier, you have one of 2 risk assessments, risk assessment A, which helps to establish the level of risk involved in using the tool. And this acts as a checkpoint or gateway for the person adopting the tool to ensure that they have considered any alternatives and if the tool complies with existing standards and principles. In the second tier, are prompts covering what data was used to develop the tool and if this data is likely to be biased in any way. Going back to the earlier example I made about a tool to detect skin cancer, these questions are where the issue of a lack of data from a Black population would be flagged as an issue that needed to be addressed before using the tool. Questions in tier 3 for the tool adopter cover the assumptions in the model and what is required for the tool to work properly, while on the proposer side, the questions cover whether the downstream user has the necessary skill requirements to use the tool and if any adjustments to the tool have been highlighted to them. Next, in tier 4, are questions to test the robustness of the tool and if it's good enough to be used for the purpose defined at the beginning, such as how is the performance measured and if there is any process in place to fix the tool if the performance drops. After this tier is the final risk assessment in the framework, which addresses what the likely negative outcomes are if the tool is introduced, such as if there's a risk of the tool having a negative impact on the environment and how you're going to address these risks. And this risk assessment is essentially the final checkpoint to make sure that the tool adopter is not taking on a tool that could have unintended consequences. The final tier of questions covers things such as transparency of data and the required licenses and documentation that need to be filled in before using the tool. And the framework ends with the tool proposer stating confidently that this is a responsible handover process that they are happy to sign off on. Now, there's a lot of questions there, but not all questions will be relevant across all sectors. It's intended to be fully modifiable and adaptable depending on the sector you're working in. Some people may find that they don't need as many layers of questions that we have here, or that there are some key questions that are missing specific for their field. We don't expect the framework to be used as we've displayed here, but to act as a basis for future guidance and governance. Similar to COSH forms in research labs, where the layouts are similar, but the questions vary significantly across disciplines, a COSH form in a biochemistry lab is going to look completely different to a facility using mice models, but the way the COSH forms are laid out in both scenarios are similar. Importantly, this is not intended to just be another bureaucratic step or rigid framework in AI governance, but as something that can really help drive innovation and boost confidence all across the tool development chain, so that the public feels assured that these tools are safe. It may feel like handing over a piece of software is time consuming and a bit daunting, but handovers are not a new thing, and the process is well established all around us, both formally and informally. For example, any medication we take comes with an extremely detailed list of potential side effects and guidelines on how and when to take the drug. We would never conceive a situation where we're giving a drug to the public without addressing the potential risks. Other examples include things such as a README file detailing how to run a piece of software, how it was developed, and any notes on version history. Whenever a piece of code is written, it's detailed how it was written and any backup procedures. And lastly, from a more easy to understand process for some in the audience, lab protocols, which, when written well, are well detailed and unambiguous to the person taking on the protocol. I'm now going to introduce a few case studies we did where we actually tested the responsible handover framework during different stages of tool development and highlighting what the benefits were in those cases to following the framework. The first case study we did is about how responsible handover has helped clinicians follow regulations. And this was done with the clinical scientific computing team at Guy's and St. Thomas, who build or buy medical software. But they also evaluate research tools to see if they are ready for clinical deployments. Before introducing software as a medical device, there are multiple regulations and guidelines that need to be followed before they get approved. To determine if a tool is ready for use, you compare it to a technology readiness level, and this gives a method of estimating how mature a piece of tech is, with 1 being the least mature and 9 the most mature. And with each regulation, guideline, clinical evidence you provide, the tech is given a higher readiness level and a higher likelihood of being deployed into clinical settings. What the team did at Guys was compare and map the guidelines and regulations that they have to follow when introducing software as a medical device, such as complying with ISO regulations, and look to see where the overlap was with the responsible handover framework. And the reason they did this is it can be very difficult for tool developers and clinicians to know what regulations they have to follow without having prior knowledge of the complexities involved. So by having a list of questions to follow that would be adaptable for different scenarios, this would significantly ease the process of following the regulations. And when they did the mapping exercise, where they looked to see where the overlap was with the responsible handover framework, which is indicated here with the arrows, They found that you reach around 70% compliance just by following the framework alone, which is brilliant for someone with minimal expertise in AI regulations. And that 70% compliance would significantly speed up the process of tool adoption. The team also looked back at how the responsible handover framework would have helped shape the early development of some research tools that they ended up projecting. For example, they rejected a piece of software that, although it worked, it wasn't actually suitable for the clinicians using it because it didn't integrate with the software that they were using. And this type of error would have been picked up early in development if they had followed the framework. The second case study we did was with the African Population Health Research Centre, who are based in Nairobi. And this case study shows how responsible handover helps upskills researchers working in no low-code environments. So the APHRC, they run lots of programs on data science, with their main particular focus being on developing those no low-code platforms. And this allows people with little to no technical expertise to engage with data science and benefit from the tools and data produced. They worked on a platform called IDARE, which has the aim of addressing the lack of technical skills in African researchers. And they call this tool machine learning in a box. Researchers can upload their data, then IDARE compares the merits of applying different tools to the data set, and then provide outputs on predicted characteristics, either on a population level or individual level, such as the likelihood of someone responding positively to a particular cancer treatment. For APHRC, their handovers take place when a researcher wants to learn how to use the platform. So developers run training sessions with researchers and brief them on how to use it. When we introduced APHRC to the Responsible Handover Framework, they turned it into a training syllabus to demonstrate how their tool works, and they found it really useful on multiple fronts. Firstly, it allowed researchers and developers to clearly define what they were expecting, as people were entering these types of conversations with different goals and expectations. Then, because they could see the tool development process from the beginning, they were able to build ethical and responsible tool use, as well as ensuring that researchers comply with existing data and AI governance framework. Lastly, as researchers were part of the process from the beginning, this ensured the long-term sustainability of the new tech, as it could be optimized and improved with every iteration, and they already had the skills in the team to do this. By following a good governance framework, they were able to upskill people in their team, as now everyone involved in tool development had to become aware of the societal impact of the tool, such as what data people are using and whether they should be using it in that specific manner. The next case study is by a team that developed Harmony, and this case study shows how responsible handover can help speed up existing handover processes. Harmony brings together data from different questionnaire databases and finds similarities between questions to combine data sets across research studies. This tool has been developed for both mental health and social science researchers to compare survey data, but the tool itself is relatively agnostic and it could be used for other areas. The tool can be accessed via a web portal as shown here, or the packages can be downloaded and the code run on R or Python. The tool uses AI to score question similarities from other questionnaires to streamline the process of creating surveys. The team at Harmony highlighted what was most important for them in a handover conversation, such as ensuring that the data was fully transparent and it was user friendly for the users using it. And when they compared what they did to what the responsible handover framework guides you through, they found that although what they did was right, it required a lot of time, motivation, and prior knowledge of regulatory requirements to get everything right. And it shouldn't be a small number of people in the team with the knowledge to implement this, and that more people need to be mindful of this process. The last case study I'm going to introduce is by a team at the University of Edinburgh who developed DigiCat, and this case study shows how responsible handover can provide assurances that people are doing the right thing. DigiCat was developed to understand which specific factors are having an impact on mental health using observational studies, such as time spent on social media. And the tool makes this method of data analysis more accessible to other researchers and can be used both with own data or using publicly available data sets. So the intended users of this tool are other mental health researchers who are likely to have a base knowledge of stats and mental health data, but they are looking to expand this to non-specialists as well. They use the framework as a test to see if the handover information to researchers is robust enough and covers the right questions. The way they hand over their information is asynchronous, meaning that they don't actually have a conversation with the person adopting the tool. Rather, the information is handed over with the tool via GitHub, which is an online repository. When they compared what they did with the framework, they were relieved to find that they were doing the right thing and that this assurance is not just important for developers, but everyone downstream of this. People want to be trusted that they are producing tech safe to use and rigorously tested. So responsible handover integrates well with existing practices that's followed by everyone and doesn't conflict with existing processes. So where do we see the framework going from here? Well, for researchers, we'd like to see clear guidance for scientists. This could be in the form of case study handbooks showing how the framework can be used. If we focus on cancer research, for example, there are multiple aspects where responsible handover could be introduced. Software is being used to predict novel protein interactions, and it's also being used to predict how a patient may respond to a therapeutic. The prompts and regulations that are required for responsible software use and development are different, so detailed guidance explaining how responsible handover could be implemented in different research areas would be extremely beneficial. We need research funders to adopt responsible handover practices in their funding streams, such as mandating a responsible handover conversation as part of a grant application. The pressure to adopt responsible handover comes from the very top, and since the launch of the framework in September of last year, we're delighted that multiple research funders from across the globe have come on board by assessing their funding streams to see if responsible handover can be integrated. And then lastly, we'd like to see a shift in funding to a more sustainable model, as right now people are busy funding new things without necessarily considering whether an alternative already exists or if a piece of tech could be modified and reused. We have tools and tech that have been developed with the intended user in mind and without the necessary processes to ensure that the software has a long shelf life. So funders need to have a real conversation about what it actually means to fund sustainably. And where we are looking at in policy and society, although we're focusing a lot on research, we're focusing a lot on the innovation. We're focusing a lot on how there are wasted opportunities to improve people's lives because tools are not being developed in a responsible or safe manner. And that's the language we are using with policymakers who work in tool procurement and commissioning. And what I mean by that is policymakers who are choosing what tools and tech to introduce to society. This could be a tool to detect the level of benefit fraud across the nation or approving the use of facial recognition technology in crowded spaces. These are real world uses of the tools that are being developed, but they've garnered lots of criticism recently for how safe they actually are. A lot of the time, they have biases inherent to their algorithms that were not picked up during development, and this could have been spotted if a responsible handover conversation had taken place. We've spoken at length with UK policymakers in both national and local government who all have the same concerns about how these tools are being developed and used. It's not just UK-based policymakers who are concerned about this. Along with other international bodies, the UN has also identified the handover process as having a significant governance gap, and they published a report on AI where they discussed this very issue, and this was released not too soon after we launched the Responsible Handover Framework. We feel confident that the public, whether that being scientists or even someone with minimal technical knowledge, have a real role in creating awareness and putting pressure on policymakers, funders, and organizations to adapt responsible handover practices. These tools created affect all of us, and people want to see that they've been developed safely. We want responsible handover to integrate with other quality management systems and governance. We don't want the framework to clash with these existing regulations, but to complement them and make them easy to follow. A good example of this is the work we did with Guy's and St Thomas, showing how the framework maps with clinical regulations. And we're really keen that this piece of work continues and expands upon in the future, and that we can have an integrated quality management system with responsible handover processes introduced to all clinical settings in the UK. And finally, we are in discussion with the Institution of Engineering and Technology to create an online platform where people can create and upload versions of the framework they've designed themselves, so that someone who is working in, let's say, nuclear engineering can create a version of the framework that they can upload, and someone working in the sector can then download the framework and see what prompts are needed to script a responsible handover conversation. So that's where we are at the moment with responsible handover. And it's been a project that's developed extremely quickly over the past year or two, somewhat mirroring the extraordinary pace at which AI has affected our daily lives. And because of this, we're particularly keen for responsible handover to become a mainstay in tool development so that we can really benefit from all the innovations that is happening in research institutes. I focused mainly on how responsible handover can be introduced and benefit people in research and clinical settings, but this is a framework that can and should be introduced into other areas such as the financial sector and agriculture. And it's especially important that the framework is introduced across the globe and does not focus solely on the UK and Western Europe, which we have tried from the beginning with our initial case studies. And we hope to continue making progress in all of these areas. And as a final point to end on, if there is anybody working in tool development or is using a piece of software that they are concerned about using, take a look at the responsible handover framework and see how it compares to your existing processes. Use the framework so you know what are the prompts you need to cover when having a handover conversation. And this framework is available on our website. If anyone wants to find out any more information about responsible handover, please get in touch with us via email. We'd be delighted to have a chat with you to see how we can implement responsible handover practices on your field. And we're always on the lookout for new partners to work with us across different sectors across the world. So please get in touch. Thank you.
Thank you, Sam. That was amazing. It's so inspiring to see the work that you've done over the last several years around this area. It's something that people worry about, but relatively few people do something about it.
Mhm.
So you and the wider team have really taken on things on behalf of the public, and I think it is amazing. Thank you.
Thank you.
I also want to thank you for the diversity of applications that you showed through your case studies,
Mhm.
because I think this really brought to life how versatile the tool is.
Mhm.
It can be hard for people sometimes to think about things if they're not looking at something that's fairly close to their own area of
Yeah.
expertise. So that was great as well. Um, We will wait and get some questions in the Q&A box, I hope in a few minutes, coming through as we talk. But I'm going to start off with one for myself. So when I'm imagining this tool and a piece of software,
Mhm.
um, does the outcome of using the tool travel with the software from handover to handover to handover so that it kind of goes with the tool like a passport? Or is it more likely that these handovers might be in a central repository somewhere and people have to go look it up? Because I'm just wondering, in a context of multiple handovers, how people connect together what happened at earlier stages. Perhaps you'd
Mhm.
know some of this from your case studies.
So, in terms of how you would detail the handover conversations taking place, it would really depend on the sector that is being introduced in. I think there are some sectors whereby you do have a list of all of the kind of risk assessments that happened upstream, in which case you could integrate the results of that handover conversation into those processes. But in situations where you're handing over a tool across multiple years globally, it's more likely that the handover conversations may be a little bit independent and that the
Yeah,
we're more interested in the information flowing downstream rather than necessarily someone saying 5 handovers ago there was a handover conversation. If the handover conversation has gone as it should have, then all of the necessary prompts should then reach that person whose turn it is to have the handover conversation.
Oh, I see. So if there was an unresolved issue at one level, then that unresolved issue would carry forward into the next handover. Is that how you'd make sure that things didn't get lost along the way?
Yeah, there would be like a clear link where you can kind of go back to see how this tool has been developed. So you would be able to see, okay, so started from the statistician all the way down. Um, I think there should be a case study. We're still doing case studies at the moment and looking for more case studies in the future. But I think one that would be really beneficial for us to use is maybe a tool that's had a really long journey path. Because I think that would be a valuable addition to our repository. I think at the moment we may be a little bit limited on maybe two or three handover conversations, but there's definitely situations where it's traveled 20 stages, and I'd be interested to see what the best format of that would be. It's a really good point there, actually.
I'll give you a moment to note that one down. Hopefully, some of the other questions that are here will also help you with points to develop the work. There's a question in the Q&A at the moment that I think I know the answer to, but I will let you answer rather than me. So it says, sorry, I may have missed this. Is there a cost associated with this tool?
The framework is free to use. It's freely available online. I'm sure it will be linked in the chat at by someone else listening from Sense About Science. But yeah, the framework is online at the moment. You can work your way through the questions. We have no intention of making it products to profit from. And we're really keen for people to use this however they see fit. And one of the work we're doing in the future, which I mentioned, is that work with the Institution of Engineering and Technology, where people can go onto an online platform and then download versions of the framework that have already been created, or adapting and taking questions out and changing the layout of how the conversation takes place. So it's is freely available to use.
Thank you. I thought that was the case. So you were talking about adapting it for other uses. There's a question in the list which shows, I think it probably would echo some other people's thoughts. How do you start to adapt the framework for a particular field? Because it can be hard for people to see how to move from the general to the specific. Are you able to talk to that a little bit?
So in terms of adapting the framework, the way we've done it with the other case studies is they would go question by question and see if the question is applicable to them in that particular scenario. There's one case study we're doing at the moment, where they've gone through all the questions and then just went, this is applicable, or no, this isn't applicable, not relevant to us, in which case it would just be removed from that handover conversation. And they've also had questions that were relevant to their sector that were missing, and that can just be slotted into the handover conversation. So you would start by working your way through the framework, seeing what's applicable for you. If the layout works for you, then great. If you feel that there's anything missing, such as other regulations, then it would require someone who is familiar with those regulations to then input those into place. But then once it gets created in a particular sector or using a particular tool, then that should then ease the handover conversations for everyone using it in that sector or using that tool. So it might take a little bit of adapting at the beginning, but that's to make it as usable as possible in each sector. That's what we'll have to take.
Okay. So thinking about this adaptation of the tool, to some extent, is there any need for any quality assurance about the way the tool has been adapted?
In terms of how the framework has been adapted into other settings.
Yes, as I'm just thinking about if there's lots of different adaptations, and it's still, I guess, going under the banner of using the responsible handover um, name, if you like. I'm thinking if somebody has decided to take chunks out because it's too difficult,
Mhm,
that adaptation is reducing the effectiveness of the tool. Now,
mhm.
there's a sense in which you can't control that. There's also a sense in which anything might be better than nothing at the stage that we're at now. But I suppose there is something about, for example, this website where people are going to, in the engineering sector, put in multiple adaptations for a discipline specific field.
Mhm.
Will there need to be a kind of peer review system around those, do you feel? Or is this something that you think is going to emerge as the use of the tool beds in?
I think for those initial adaptations, you could embed a quality assurance process on the online platform that we're designing, whereby experts can take a look at the adaptations and assess how relevant they are to the sectors they've been adapted in, and if it includes all of the regulations, and if the conversation flows in a logical format. So we could have people grading each iteration of the framework that gets uploaded onto the platform.
Mm. Yeah, that would be something to, I think, over the next few years
Hmm.
to watch and keep an eye on. There's a nice question in here, a short question, which is about human nature. And again, we can't control for that,
Hmm.
but we can nudge and things like that. So one of our participants asked, wouldn't it be very easy for people to tick all the boxes regardless of the truth?
Well, the way the handover conversation is structured, it's a two-way conversation, where you've got the tool adopter and the tool proposer having that conversation. It may be in the interest of the person adopting the tool to just want to tick through all the boxes as if it was a bureaucratic exercise, but it wouldn't be a proper handover. The tool proposer is having that conversation with them. The tool proposer would not want to hand over that tool to someone who was just treating it as a tick boxing exercise. They wouldn't release the responsibility of the tool to the tool adopter. And what we're keen to ensure is that this is integrated into proper frameworks and existing governance, so that if someone is using it as a tick boxing exercise, then they wouldn't be getting access to this tool. And it's really only an hindrance to themselves, where they might be taking on this tool. They've done the responsible handover as a tick boxing exercise, and then they don't know how to use the tool, or they've caused serious harm further downstream. So it's really to the hindrance of the tool adopter that they are treating it as a handover exercise. And if they do end up causing serious harm further downstream, that then reduces trust in whatever research or product they're putting out. So I guess with any regulation, it can be treated as a tick boxing exercise, but it's the way the conversation is structured that's hard to do because of the proposer being involved in that conversation.
Mm,
And the proposer
yeah,
would not want to hand over a piece of software if they feel it's going to cause harm.
yeah, absolutely. Um, we have to expect people to work with professionalism.
Hmm.
Um, and occasionally somebody won't, but there are other mechanisms around that as well.
Hmm.
Um, so this question that's been put into the Q&A function is quite interesting. It's quite long though. I'll read it slowly. So any form of handover requires AI developers and engineers to make certain statements about the behavior of their systems. So the accuracy, the reliability, the applicability. And so the question is suggesting that the theories, techniques, tool, and tradecraft to support or challenge the ideas about accuracy, reliability, and applicability, and so on, don't in general exist at this stage. And then he's put, please prove me wrong. In reality, do we have the ability to answer some of these questions in the tool as it goes through?
I was reading the question alongside with you. Yes, we've tested it to make sure that they are public accessible so that people who are less familiar with these tools and tech can ask and answer them. But we've also tested them with developers at those high-end levels of tool development. So it's intended that they can be answered to the best of their knowledge. If a tool being handed over, and for example, it says we are not familiar with the accuracy, we can't test for the accuracy, we can't test for the reliability or applicability, that is part of the handover conversation. The person who is handing over, who is receiving that information, can make a judgment call based off that information. Just because someone might not have the ability to have those assertions, that information is still valuable for everyone downstream if you don't have the tools to assess all of that. So I think the question is still valid in the responsible handover framework. Because someone is unable to answer it because of the nature of their sector, that's still extremely valuable to know in that handover conversation.
Thank you. I think in the Q&A you've got some people who would possibly like to connect to look at using this tool a little bit more. So I don't think we need to talk to those directly. Obviously, this information will be available. Some thanks for your talk. I'm just scanning to see if there's more questions come in. Links have been asked for and have been provided in the chat function. We've done that in the background while you've been talking, so that's fine. You talked about kind of where next. It seems to me like there's a lot of work around raising awareness. There's work about embedding in structures that will matter because it's embedding it in money flows. If you look at the research, councils adopting it and so on and so forth. Is there anything else you want to say about where next with this work?
Yeah, so I think the two things I've already mentioned the platform we're creating, but one thing I'm really excited about is we're working with the International Science Council on
Yeah.
a toolkit for policymakers to assess whether they should be using an AI tool and how to use it. So the International Science Council created their own guide last year, giving some prompters where policymakers can assess the impact of introducing AI tools, because policymakers are obviously involved in procuring these tools. And we're looking to combine our framework with their guide into an easily understandable toolkit for policymakers. And this can be rolled out. We're hoping to roll this out with various ministries abroad. We're working with people in New Zealand on this. And we've also had conversations with the Department of Science, Innovation and Tech, as well as the people who launched the algorithmic transparency recording standards, because although the transparency standard was released a few months ago, they've had quite low uptake of people uploading what tools and tech public sectors are using. So there is real struggle in the public sector, especially in the UK, to get people on board with this. And the hope is that the creation of this guide can help policymakers assess what the impact is of introducing tools to the society. And once they've gone through that impact assessment pre-commissioning, they can then work through the responsible handover framework. And that process of handover conversations becomes well embedded in the governance that regulates tool procurement. And alongside our work with ISC and IET, we're also having similar conversations with American research funders, Australian research funders, the EU, and the Netherlands and India as well. So the real hope is that we can create guidance that is really specific to those research environments, maybe translations of the framework or tailoring the language used so that it's suitable for the regulations that those researchers have to follow. So we've got lots of avenues at the moment, and we're very keen that we're not just focusing on one aspect of tool development, but that we're also hitting from the beginning of tool development all the way through to policymakers and everything in between as well.
Great, thank you. So this tool is about trying to make things as robust as possible as AI is handed on and on. And you'll see in the questions that are coming in that some of our participants today are participating in the development of this tool by asking how it can be made as robust as possible, in effect. So another question that's come in this strand, which is but can we do it? How do we do it? Is it really true? Is it over
Mhm.
optimistic strand that we've been reading? Um, is one that says, how do parties test or challenge the other party's assertions? How could a judge adjudicate the dispute?
Sorry, you cut out there a little bit. Is
Oh,
that
sorry.
how? Could you repeat the question?
Yeah, so when parties are involved in using the tool, it's how do parties test or challenge the other party's assertions? How does a judge adjudicate the dispute?
So that's a good question. I think for the tool proposer, they're handing over information that is essentially new to the tool adopter. I, I, I wouldn't necessarily say there'd be much dispute in terms of that kind of handover conversation. I think the tool adopter is then answering questions that could be specific to their tool use. I can't see much of a dispute happening in terms of how in terms of that information happening. But if there are sectors where people feel that dispute could happen, again, that would be a very beneficial case study for us to do.
Yes, I'm imagining there will be dispute, humans being
But I
humans.
think that also comes back to your point of just professionalism in the workplace, to be honest, as well.
Yeah, of course. So we're 3 minutes from the end. Um, questions come in late about the likelihood of working in Latin America. I think that's because of the other continents already um, mentioned. Is
Mhm.
there any work in Latin America on the horizon?
We haven't approached Latin America as of yet, but one of the other projects we work on, the Risk Know-how project, which seeks to give people the required information to understand how risk is involved in their daily lives and work, is we have a really strong link in Latin America already, Mexico and Puerto Rico especially. So we have existing networks in those regions. So we are looking to move into Latin America in the future, leveraging those networks, but we haven't had any conversations as of yet. But we'd be particularly interested in that because we are aware that there's various avenues where we can definitely help in managing those risks of introducing new technology.
Great. Well, I think this particular participant is interested in Brazil. And as such, you'll be able to follow up afterwards because we'll be able
Mhm.
to see these questions later. So with 2 minutes to go, I'm really pleased that there's been some lively debate in the questions and answers, and people who think this is over optimistic, as well as people who think that this is something really new and they'd like to be involved and do much more. I think even the people who think it's over optimistic probably still would want to engage. It is just brilliant to see this work and have it presented to us over our lunch and learn session because it's really thought provoking. And I think what's important is that you and your colleagues have seen a gap. You're doing something and you're doing something that's scalable, and engaging with people in ways it can be scaled. There will
Mhm.
obviously be many, many years ahead to refine and to optimize this tool. But the foundational work you've done to get it to a point where people who are not specialists can actually begin to engage with it hands-on
Mhm.
is really, really commendable. Thank you for
Thank
sharing
you.
with us today.
Thank you. Thank you for having me.
Not at all. I think we're due to finish now.